Well, team, I am showing it's a little after 1 o'clock here on the Eastern time zone, and I want to welcome everybody to a great call today. Introduce a few folks first. I want to thank everybody for having their microphones on mute. And also wanted to introduce who we have our marketing liaisons here for the Morel Company, and that is Miss Danielle DeWitt and Mr. Sean Townsley, who serves as our Director of Marketing. And I am Brad Fine. I'm the Regional Business Director for the Southeast area of the company. And I wanted to pass it back to Sean now for a word from our sponsors.
All right. Well, thank you, Brad, and thanks everyone for joining, leading the evolution of nursing through innovation and automation. A little bit of housekeeping first. As Brad mentioned, everybody's mic is on mute. Just be sure that as questions come up, just enter those questions into the chat. Type your message between Brad, Danielle, and myself. We will raise those questions at the end so that our presenter can cover them. A quick word from Hercules. A little video here that shows how Hercules works. Here we have a caregiver pressing 2 buttons on the side of Hercules, and we see a patient being boosted up in bed. Hercules is a very simple, straightforward solution. It consists of 3 components. We have a drive unit. That's the box that sits at the head section of the bed. We have a mattress. And then now we're seeing our dream sheet, which is twice as long as your standard cotton fitted sheet, replaces that sheet so there's 1 layer under the patient at all times. Now we see a caregiver attaching the sheet. She's clipping the sheet into the mattress, and she's pressing the buttons on the side of the drive unit to advance the sheet into the drive unit. Now we see a patient on the bed, and the caregiver is safely boosting that patient using Hercules. You'll notice that there's no lifting, no tugging or pulling, a very comfortable and dignified experience for the patient. Maintains their dignity. You'll notice the covers are on, head of bed angle is raised. So to change the sheet, we're going to simply release from the sheet clips. We're going to press the sheet release button on the side of the drive unit. We're going to pull the sheet out of the drive unit, release it from the sheet strap, and place that sheet into soiled laundry. Hercules fits on virtually any existing healthcare bed frame. We can safely boost patients up to 750 pounds. Just an overview of the impact that you can expect from Hercules. You can improve nursing retention. In a survey of nearly 5,000 nurses, we've asked, will Hercules extend your bedside career? 89% of those respondents have said yes, with 62% saying that Hercules would extend their career 5 years or more. We will eliminate boosting injuries. There's no chance to injure yourself pressing the 2 buttons that are on the drive unit for Hercules. It is the safest way, the only safe way to boost a patient up in bed for both the caregiver and the patient. We're saving nurses time. So typically a nurse is boosting a patient 11 times per shift. This takes an average of 7 minutes or 77 minutes over the course of their shift. Versus boosting with Hercules, we're looking at 10 seconds per boost for a total of 2 minutes. And so we're saving that nurse over an hour per day. This is time that they're able to provide direct patient care. They're able to maybe take a little time for themselves, clock out and take a lunch, clock out from their shift on time. And so we're saving a tremendous amount of time that can be utilized for more important activities for the patient and the nurse. We're seeing a reduction in infection exposure in contact isolation rooms. We're sending 1 caregiver into a room versus 2 or more for traditional boosting methods. We're sending that caregiver into the room for an average of 10 seconds. There's no physical contact required to boost the patient. From a hospital-acquired pressure injuries standpoint, we're decreasing HAPIs The position in bed, which is so important to be in that up in bed, safe, low pressure position. Hercules does a better job than any solution in the marketplace to keep that patient up in bed. And it's so easy to use that every time the nurse enters the room, they're able to boost that patient back up in bed, even if it's 3 inches. It's just a very safe position. And with Hercules, you can ensure that the patient is staying there. And just the overall patient experience, the patient doesn't have to wait to be boosted when they're taking medications, when they're waiting for a meal, that the patient is in that safe, up in bed, comfortable position where they can best receive care at all times with Hercules. So what are we talking about? We're talking about eliminating boosting injuries. So nursing is one of the most dangerous professions. So here we see this, 1, 2, 3 boost being the nurses pulling the patient manually up in bed versus the simple push of a button with Hercules. And we're required to do more with less today, right? And so with Hercules, it's enabling us to do that. So fewer nurses are entering the profession. We're seeing an extended nursing shortage. And so with Hercules, we're able to replace this high burden, low value task with an efficiency through automation. All right, at this time, I'm going to turn it over to my colleague, Brad Fine.
Yep, everyone, thanks, Sean. Real honor to introduce our keynote speaker here today. Neva Spencer is the Chief Nursing Officer of HCA Florida University Hospital in Davie, Florida. Dr. Spencer coordinates all daily nursing operations, ensuring an exceptional patient experience with the highest clinical quality for her community, investing in and retaining nursing, and nurturing an outstanding professional practice environment. Now, before transitioning to HCA Florida University, Dr. Spencer previously held the role of Associate Chief Nursing Officer at Wesley Medical Center in Wichita, Kansas. During her nursing career, Dr. Spencer has been a leader in Denver, Colorado, with HCA for over 28 years, and Banner Health in Phoenix, Arizona, for 5 years in various progressive leadership roles. Dr. Spencer has extensive experience in the ANCC Pathway to Excellence and Magnet Nursing Journeys, and she also had the privilege to be involved in writing 3 pathway documents and 8 magnet documents. Wow. Dr. Spencer received her associate's degree in nursing from Fairmont State College in Fairmont, West Virginia, her certificate as a neonatal nurse practitioner, and her bachelor's degree from Beth El College of Nursing in Colorado, and her master's degree from the University of Colorado, Colorado Springs, and then, of course, her doctorate in nursing practice from the University of Colorado in Denver. Dr. Spencer began her nursing career more than 37 years ago. And on a personal note, Neva is married with 3 adult daughters, 4 grandchildren. She lives in South Florida with her husband, John, and their Cocker Spaniel, Coconut, where they enjoy playing golf. And rumor has it that she just scored her first eagle in golf last weekend. So she's on a roll, folks. Welcome, Dr. Neva Spencer.
Thank you. Yes, I did get my first eagle. It was a long time coming. So I just wanted to talk to this group about leading the evolution in nursing through innovation and automation. I'm very privileged to work down here in South Florida and to bring the Hercules product to my nursing and patient care staff. So today during the meeting, and we're going to be, I'm a very informal person, but we did the welcome and introductions, the sponsor message, and then I'm going to talk a little bit about HCA Florida Healthcare, my personal journey in nursing leadership, the current state of nursing, which all of you are probably very familiar with, how we evaluated this technology using the lens of the magnet model to help connect all of those dots and help make the conversation even more impactful as we're looking at funding sources. Some of the challenges that we have in healthcare, how to simplify the work, some of the funding realities that we face in healthcare, and some of my future goals to make the experience better for my patients and our environment better for our staff. And then we're going to wrap up with participant question and answer from the whole team, not just me. So next slide. So I want to talk a little bit about HCA Florida Healthcare. HCA Florida Healthcare is how we have branded our HCA Florida hospitals. In Florida, HCA has 46 hospitals, over 13,000 licensed beds. Across our company, we have over 180 hospitals in 21 states and in England. And HCA employs over 100,000 nurses. So truly, we consider nursing the differentiator in HCA Healthcare, and we know the nurses in HCA Healthcare will change the healthcare world. So very, very pleased to be part of this fine organization. Our mission in HCA is, above all else, we are committed to the care and improvement of human life. One of the things I love about this mission statement is the human life part, because it doesn't say patient life or provider life, it says human life. So this product, the Hercules product, actually directly links with that commitment I've made to improve the care of human life of my staff members and my patients. So my hospital is that beautiful hospital you see on this screen. It's located in Davie, Florida. And for those of you not familiar with Davie, Florida, Davie is about 23 miles north of Miami, north and slightly west. And it is about 15 miles south and west of Fort Lauderdale. So definitely in beautiful southern Florida. Our hospital opened in November of 2021. And I was privileged to be selected as the Chief Nursing Officer in January of 2023. So about a year after the hospital opened, and now I've been here about 14 months. We have 165 licensed beds. We have 650 employees. Of those, about 350 are nurses. Our care delivery team consists of nurses, aides, patient safety attendants, LPNs, and RNs. We also have APRNs in our organization. Of course, we have 24-hour emergency care and a full range of comprehensive inpatient and outpatient care at University Hospital. So this audience knows what the current state of nursing is. Nursing turnover has been at an unprecedented rate for years, causing a nursing shortage crisis, which continues and is unanimously agreed upon to be the single greatest challenge we have in healthcare. So I wanted to take a moment and provide you with some newly published data out of AMN Healthcare that was released in 2023 that surveyed over 18,000 nurses. And this survey was compared to a 2021 survey, which was during COVID. There continues to be a dramatic shift with regard to how nurses perceive their role in profession. You know, looking from 2021, right in the middle of the pandemic, to 2023, things did not get better for our nurses, they got worse. It had been stable, but we've had a drop of 10 percentage points in career satisfaction for nurses. We declined 12 points in satisfaction with the quality of care they provided. And nobody became a nurse to not provide quality of care. So to have to reflect on yourself and have a decline there is not something that resonates with the heart of nurses. Feeling emotionally drained rose. So they don't feel like they're doing a good job and they're emotionally drained and they're not satisfied with their career. They worry, huge jump, to 19-point jump in thinking that their job is affecting their health. And 68% of our staff said that most days they feel burned out. And when we're in the middle of a nursing shortage and we're feeling bad about the work we're doing and the care that we're providing, and we are saying we're less likely to recommend other people to go into the profession, is something that hurts the hearts of nurse leaders everywhere. You know, one of the biggest challenges is this nursing shortage in the next 5 years, and 80% say it's going to get worse. And it's with it getting worse as people are living longer, and our communities are having more and more comorbidities and health issues, we are just digging a hole, and we've got to figure out a way to help our nurses feel better about the work they're doing, feel better about the shape they're in as they're doing the work. McKinsey and Company's study suggested that by 2025, there's going to be a projected gap of 200,000 to 400,000 nurses, which is a 10 to 20% vacancy rate across the country. Just huge. And they're going to be caring for us. So the ANA and the AACN have weighed in on this and have recently, back in 2023, also published some workplace imperatives. One of those imperatives is to innovate the models of care delivery, where two of the specific recommendations were reduce that physical workload and cognitive overload, and prioritize high value patient care by removing high burden but low value nursing tasks. You know, as Sean mentioned earlier, manual boosting with multiple care providers needed to do that is a high burden, low value task, and it can be automated. So why not automate it? And that's exactly what Hercules does. So I'm going to talk more about how Hercules really links with what we at the ANA and the AACN have said might help it make the day better for nurses and for our patients. So I'm going to talk a little bit about my personal nursing journey. As Brad said, I started my nursing career in rural West Virginia. And not all of West Virginia is rural, but the part I grew up in was. I went to Fairmont State College in Fairmont, West Virginia. And from there, I moved to Denver, Colorado for 28 years and worked there. Clinically, I am a neonatal nurse practitioner and a clinical nurse specialist. Then after working in Denver, I went to work in Phoenix, Arizona. And it was while I was in Phoenix, Arizona, that my senior vice president of nursing showed me a piece of technology that she actually had been exposed to when she was in Ohio with Mercy Health. And it was the Hercules product. So she showed it to me. My role there was a senior director of professional practice, senior director of nursing. And she said, I'd like for us to explore getting these in some of our hospitals. So I met with the Hercules Morel team, and they showed me the product. And one of the first things I said was, the simplicity of this product is amazing. There's nobody that can't use it. And why didn't I think of this? So at Banner Health, the approach we took was I had 28 hospitals in Banner Health, the largest footprint being in Phoenix, Arizona. So I took two very different hospitals and two very different patient population units, and we piloted the beds in two of these. So I could use my my vast bed space. Banner controlled over 6,000 beds in the Phoenix area. One of the hospitals I piloted in was a level 1 trauma center, and we put it in the neurotrauma step-down unit. So patients with traumatic brain injuries, patients, paraplegic, quadriplegic patients, and experienced nurse workforce that really was trying to get patients comfortable, a lot of pain management issues, and then get patients to rehab. The other hospital we put it in was a hospital on the east side of Phoenix, where the average age of the patients was approximately 76 years old. It was right smack dab in the middle of a retirement community, and it had, the unit we selected had a large number of hospice patients and elderly patients. So I was able to put it to nurses, give it to nurses that were doing very different work, and find out what they thought of the product. And overwhelmingly, they appreciated the product and wanted to purchase the product. So very pleased with that. When I left Banner Health and rejoined HCA, I went to Wichita, Kansas. And in Wichita, Kansas, Wesley Medical Center is a very large hospital with a level 1 trauma unit also. It has a large children's hospital, a large delivery service, and it is right smack dab in the middle of the country. It received transports from the entire state of Kansas and northern Oklahoma. And so in Wichita, I had experience with the product. So we brought it in there, and I didn't really pilot it. I had our Morel Hercules team do a video, do a WebEx meeting similar to this, show some of my leaders the product. And when I asked if they wanted to pilot it, their question was, why waste our time piloting it? Let's just buy some, because it was overwhelming what they wanted it for. Large oncology population, large trauma population in Kansas. And I think my little jet is now supposed to fly from Phoenix back to Kansas. Yep. We put some automation in here. Wesley Medical Center has actually 2 hospitals that we put the product in, and different, our smaller hospital had a large bariatric population, so the product worked very well with our boosting in that facility. After I was offered our CNO job down here at HCA Florida University, I'm very pleased to be able to bring the product down here to Florida. I will say in Phoenix or in Banner Health, there's now over 200 beds with Hercules attached to them. In Wichita, there's 24, and I have 10 down here in Florida, South Florida at my hospital so far, but I'm going to get that number to grow. My patient population down here in South Florida at HCA University is a very mobile, for the most part, population. We have a large orthopedic patient care base, and this works very well with that early mobility and the lifting issues that we have with patients that have mobility issues. So down here in Florida, what we did is we brought in 10 units from May to June of last year. And I put them, I split them up and put some on my 4 North unit, which is a progressive care unit. A lot of patients with comorbidities and significant pain issues with sickle cell crisis don't particularly want to be mobile when they're in significant pain. And then on my 4 South, which is my surgical unit, which has large, as I said, orthopedic population, and that's our bariatric area also. So my staff loved them whenever we put them out to be trialed by them. And it was interesting because I'll talk a little bit more about funding, but HCA does a wonderful thing for our hospitals to where we get nursing capital dollars every year. I fondly call it the CNO checkbook. And directly from staff feedback, we make up lists of equipment that would make their job easier, that would improve the patient experience for them, would, you know, make them not have to search for things in the middle of the night, make them not have to get extra people to help boost. And when we were piloting our Hercules beds, that's when we found out what our dollar amount for the CNO nursing capital was going to be for the year. And I was rounding on the unit, and I was telling them how much money we got. And I said, and we're going to be able to purchase the Hercules beds. And they actually started clapping right in the middle of the nurses station, because they saw such benefit from the brief pilot that we were doing. So we purchased additional beds in July and October and added them to the ICU. And we're continuing this adoption journey and identifying additional areas where we could use this product. Next. As Brad said, my introduction, I was very involved in the magnet journey in many hospitals. have extensive experience. It's truly one of the professional highlights of my almost 38-year nursing career was being involved in magnet journeys and the pathway to excellence journeys for teams. And, I've written over 8 magnet documents, 3 pathway documents, participated in writing those, excuse me, Lord knows I didn't write the whole thing. But when I looked at the magnet model and I looked at this product through the lens of the magnet model, it really allowed me to connect the dots for my staff, for the business case, for the quality outcomes. And we're going to talk a little bit more about those. So, simply when you look at the element of transformational leadership, the Hercules products improves nursing retention. It reduces burnout. It extends the career of bedside nurses. We're going to talk more about data in a moment. 89% of the nurses say Hercules would extend their career, and 62% said it would extend their career, they believe, from 5 or plus years, which is wonderful when you think about this nursing shortage that we are entering. Next. When we look at structural empowerment, it improves caregiver safety. It eliminates the #1 cause of nursing injuries, which is manual boosting, back injuries, shoulder injuries, neck injuries, hip injuries. One caregiver can safely boost by pushing a button, and it reduces career shortening cumulative trauma. If the nurses are less worn out at the end of the day when they go home, they'll have a better shift the next time they come to work. And we're so pleased that we can do that for them. It improves the patient experience. It provides dignified, safe, comfortable boosting. 98% of patients prefer Hercules when we've talked with them. And when I was in Banner, one of, looking with the magnet lens and wanting to look at the data and using the data to tell the story, in our neurotrauma unit at the Level 1 Trauma Center, I surveyed staff in that unit. In the other hospital where I had the large elderly population, I actually surveyed patients and families in that space. And 94% of the patients felt safer with Hercules. One of my things that so got me committed to this was something an elderly lady said to me when I was talking with her, doing rounds in the hospital at one of the hospitals in Phoenix. And I still get emotional when I tell this story. And it happened back in 2019, and it still resonates with me. This lady's husband was dying, actively dying. He was a hospice patient. They'd been married over 60 years. And she sat at his bedside and she said to me, when I went in and I was talking to him and I was asking her, about how her stay was and how his stay was and how the nursing care was, and, doing those things that we do in purposeful, intentional leader rounds. And I asked her, about the Hercules bed. And she said to me, we've been married over 60 years and I've taken care of him all that time. She said, and now at the end of his life, when he is most vulnerable, the only thing I can do to make him comfortable is push that button. That's all I can do. And that just said to me, this product has a place, because she just wanted to care for her husband. And that's how she cared for him, trying to make him comfortable in bed. Product also, when we think about new knowledge, innovation, and improvement, certainly this is innovative, and it's so simplistic that what I like is innovation doesn't have to be this unsurmountable bells and whistles and technology that we have difficulty using. We've been given a lot of technology in healthcare, and often it'll sit in the corner because it is so complex to use. but not this product. But it improves caregiver efficiency. It reduces the time to boost. One caregiver can boost a patient in 10 seconds, and it saves over an hour per nurse. And the other part of this caregiver efficiency is you don't have to go on a best case scenario, get one more person to help move. But we all have cared for those patients. If you've been in a hospital where it takes 4, maybe 6 people to move a patient, when you look at people with higher BMIs, to safely move them. And, you know, I had a gentleman tell me, he said he was using he was on one of the Hercules beds, and he said he loved the bed. And he said in previous hospitalizations, he said, you have no idea how embarrassing it is to lay here, be uncomfortable, be in pain while they try to find enough people to lift you in bed. So from the dignity perspective, just knowing that the nurse can come in and it's part of the care to help him get comfortable and not, you know, hurt his dignity. He told me, he said, I know I'm a big man, but it still hurts to know that it took that many people to lift me. And then when we look at empirical outcomes, which those of us familiar with Magnet knows pulls everything together, and we love for the data to tell our story because there's a patient behind each and every one of those data points, and that's what we can't lose sight of. It's going to encourage more frequent patient boosting, which means it's going to decrease our hospital-acquired pressure injuries. It's going to have reduce friction and shear and skin tears. It's going to help with pain management. So really, there is a lot of usable data that comes out of this. What I like about this Hercules is it was specifically designed to help nurses. A lot of things we have in nursing helps us, but it probably wasn't the goal when it was invented. But the people that invented this product did it to make the nurse's day better. And now we're seeing other benefits from it also. Next. So I'm a simple person, and I go back to how do we make it easy to do the right thing and hard to do the wrong thing. And I grew up on a farm in West Virginia, as I said, so I know a little bit about farm work. That's me on my horse, Danny Boy. And I worked on this farm, and making hay in the summer was one of the things that we did. And from, you know, the first thing I ever drove was a tractor, and that was part of my role, and running the conveyor belt. So when I first saw this Hercules product, I'm like, I've been using conveyor belts on the farm since I was a little girl in Jane Lou, West Virginia. Why didn't I think about this? So when we can simplify work, we need to simplify work. And what's great about this product is it truly simplifies the work. It's like throwing a hay on a conveyor belt when I was a little girl. So there's other equipment available. We know that there's portables, there's overhead lifts, but they don't simplify the work. First of all, you got to go track them down if they're not already in the room. If they're already mounted in the room, you have to use them. What we find is we don't use them because they're not simplistic enough, and they're not nearly as dignified as this. So next slide. As I said, you know, we're not the first HCA hospital to get these. I've now put it in 3 HCA hospitals. However, these are a list of some of the HCA hospitals where we do have the product. And I'm going to show you some data that is just HCA Healthcare's data that the Morel company surveyed when they placed these units. And as you can see, we have hospitals, there's not a lot of units. I would love to have one on every single bed, but I know I can't start that way. So if you look, we've got hospitals in Florida, We've got hospitals in North Carolina, in Virginia, other areas of Florida that are using it. A total of 202 of our care team members were surveyed in the upcoming data I'm going to show you, and that's kind of a distribution. We have them in specialty hospitals, rehab hospitals, hospice, and in general hospitals. So we asked, they were asked several questions. First of all, what's your job? So 80% of the people surveyed were nurses, mix of RNs and LPNs, and then 10% were PCAs, patient care attendants, CNAs, certified nurses aides, and then 10% were other. I will say in my hospital, my physical therapist and my OT team, occupational therapist team, love this product also. And, we're really big advocates of us getting this. We also ask their age, and you can look at the breakdown there. And, when you look, 30% were over the age of 50. I'm in that demographic, but a third of the people we surveyed are not that far from retirement, certainly closer to retiring than they were than starting their career. So the bulk of them had been using the product less than 6 months. And you can see the caregiver experience breakdown to the right. So got a really good distribution of people, nursing experience or care experience and age across the continuum there. The next data we looked at was, have you ever felt sore or worked in pain as a result of physical workload of bedside nursing? Now, 96% said yes. I personally think those 8 people that represent 4% just haven't been doing it long enough, because that number will change, unfortunately. And when we ask them how often, the frequency of that, it was prior to Hercules, we had 68% of the team saying that they had felt sore or worked in pain prior to Hercules. 68% said always, 25% said sometimes, 7% said rarely or never. After Hercules, we completely flipped the script on that. 12% said they always or often worked in pain after they started using the product. 33% said sometimes, and a whopping 55% said they rarely work sore or in pain anymore because of the physical workload of bedside nursing. And I believe it's because of that, the boosting that we allowed them to stop doing. Then we also asked just the HCA participants, do you believe the availability of Hercules will help extend your career? 93% said yes. And then when we asked how many years, 67% said they'd say 5 or more years now, because that physical toll has been diminished. So this makes me feel good. This is finally something that we're doing that's going to help elongate the nursing career in a profession we badly need as many nurses as possible in. Whenever we looked at, the career benefits and their bedside job, Hercules reduced, 84% said that it has reduced the soreness and pain. 88% said it improved response time when addressing patient needs, because we don't have to go find extra people to move them in bed. 85% said it improved their job satisfaction, which makes me feel wonderful, makes me feel safer. 95% said it makes me feel safer performing my duties. And 87% said that it reduced burnout and physical and mental fatigue, which to me, these are all of the things we should be doing: reducing burnout and physical fatigue, make our staff feel safe while they do their job, improving their satisfaction, getting them to be even more responsive to their patient needs, and making them physically better with pain. And I don't want anyone getting hurt at work, and this helps with that. We also looked at, what's the impact on the patient, because I believe it was invented to make nurses work better, But these are some of those downstream effects that once we started using it, it was improving HCAP scores. So we ask our staff, do you think it will improve HCAP scores regarding response time? 87% agreed with that. Can it help with pain management? 93% of our staff agreed that they believe this product would help with pain management and the hospital experience. Pain management is 84%. And then level of pain and patient experience and overall hospital experience was 93%. So very pleased with both the caregiver and the care receiver's intended outcomes with the Hercules product. So when we ask how are you satisfied or dissatisfied, 97% of the staff said they were very satisfied or satisfied. And when you ask, would you recommend that your hospital invest in Hercules, 99% said yes. And you know, I got to see that firsthand. Whenever you have a nurses station full of caregivers start clapping when they heard that I was going to buy them. So that's all I needed. I didn't need to see this data. I needed to see the faces of my team members and how excited they were that this was going to be part of our care model. So, you know, capital is always a challenge. So whenever we looked at how do we fund these, what I did was I brought them in, I let the nurses use them. They have a great pilot program to where you can get direct feedback from your staff about them. And once I showed the product to my chief financial officers and my chief operating officers, and after they saw the product, the simplicity of the product, and how it benefited the patients and the staff, then I would tell them the cost of the product, and they couldn't believe it was that economical. But even though it is priced well, I think, there's still challenges with funding them. In Banner Health, what we did was we worked with the organization's charitable arm to secure funding. A lot of the hospitals in Banner, it is a not-for-profit health organization. They had charitable foundations affiliated with each hospital. And now there's 9 different hospitals in Banner, 212 of the Hercules bed models. At HCA and Continental Division, Wesley Medical Center, both there and here at HCA Florida University, we are gifted money every year, as I said, what I finally call the CNO checkbook. And it is specifically designed to fund things to make the nurses' days better, shifts easier, to improve their work environment. So I used in both those, well, it's actually 3 hospitals because Wesley has 2 campuses. I used nursing capital funds to purchase the Hercules, and I'm doing a phased purchase plan because if I spent every dime I had on the Hercules, then I couldn't have funded a bunch of other things. So instead, what I've done is I've worked with the Hercules Morel team, and we've kind of set up a phased purchase approach to where every year or every 6 months, depending on how the money rolls out, I'll be adding more to our fleet. And they do a great job coming on site, training the staff, and bringing those beds in and hooking them up for us. So my goal, as I said, is to have one on every bed on my medical surgical 4th floor. And I'm going to be using my nursing capital. And actually, I have sister facilities down here in South Florida that are now on the Hercules journey with a similar approach of a phased purchase plan. HCA Woodmont, their CNO, Karen Bach, is very innovative, forward thinking, and she started adding them to her beds also. And I think some of her team members are, they want one on every bed also. So I believe that is my last slide, and we'll do Q&A now.
Thank you, Neva, for a wonderful presentation. Just a reminder to our participants to type your question into the chat. We'll give it just a minute or so to allow those to start to flow in, and we can certainly answer any questions that you have about the presentation. Neva, one question that we commonly receive from nursing leaders is that just with the challenges associated with change, how does a nurse leader best introduce a technology like Hercules so that it's successfully adopted by the facility, by the system?
We the team at Morel and with the Hercules product does a great job coming in and meeting with staff, and not just the nurses, but they met with our nurses aides, our physical therapists, our occupational therapists, our EVS workers, because there's a special sheet, and how are you going to deal with that sheet? But it's interesting. It's a product that, when my experience, when the nurses use it, it's a welcome change. It's not like some of the other change that we implement, to the point that it's like, no, can we put the patient in this other room? So because it has a Hercules bed on it. I'd like to someday not do that. But this was one of those welcome changes, but educating them up front, showing them the benefit to themselves and to our patients. It's one of those, sometimes they need to be reminded, oh, don't forget, we have a Hercules bed in such and such room when we have a patient coming in, for example, one of our bariatric surgery patients. And then when they remember, that's the hardest part. Since I don't have them on every bed, is them remembering, but they appreciate the change, and it's a welcome change. Because we're changing them from high burden, low value activity to big bang for our buck.
So we have a question in the chat. What is the approximate estimate cost per Hercules unit, including labor, supplies, etc.? So in general, Hercules list price is right around $8,000. That includes the drive unit, mattress option, 7 of our dream sheets, and includes the installation, the training, all of those things. And so we're happy to talk specific pricing based on your specific needs, and our local representatives can work through that with you. The great thing about Hercules is it's such a strong return on investment. We've seen a payback in less than a year, right around 9 months for Hercules to pay for itself.
Yeah, and in previous presentations, we've kind of shown that return on investment, and that decreasing one hospital-acquired pressure injury, decreasing one boosting injury where you've got a staff member now that has to come off the schedule, and then, by the way, you've got workers' comp claims, and then you've got to backfill them, and that may be premium labor. So that's why when I sit down and have the conversation with my CFO and I can say, eliminate boosting injuries, sells itself, right?
Exactly. All right, we've got another question. Have you documented or seen better patient experiences with Hercules? And Neva, I think that that probably goes to some of the survey data that you've received, as well as just other ways that you've documented the impact of Hercules.
Yeah, I'm very fortunate that we have good patient experience scores. We finished fourth quarter at 95th percentile patient experience. so we were already having good experience. So I got more of my patient experience feedback from my leader rounds that I did with patients and talking about it. So I couldn't trace it back to my HCAP scores because I had good HCAP scores already. But anecdotally and what they're telling me, they like it. The patients like it.
Hey, gang, we have another one here. Is Morel Company LLC Hercules already an approved equipment vendor for HCA or has a contract with HCA? And Alexandra, the answer to both is yes. We are an approved equipment vendor and we do have a contract.
It was very easy to navigate. It was just, yeah, that was the nice part of, you know, it's on the list, right?
It looks like we have a question from Diane. Has there been success utilizing employee safety incentive program reimbursement dollars to cover costs?
So it's interesting. We talked about using that funding, but we'd already spent it for last year. By the time we started piloting it, because my employee health nurse spent that money pretty quick. I mean, and she did it for good. She used it on good things, but that is certainly another funding source for it, as is the nursing capital dollars.
Okay, we've got another question. Have you evaluated employee engagement scores pre and post implementation with Hercules?
We just got all of our beds, and like I said, we don't have one on every bed, and it was post survey that we did in October. So I'm looking forward to the May survey that we're going to do. That'll be the first one since we were done, because we piloted last summer, but we were still rolling them out because we did a fairly long pilot and we had to get, you know, our capital funds approved and everything. So my survey in May will be the first one.
Okay, I think we're coming to the end of questions. So just as a reminder, Hercules is on the Health Trust contract, the HPG number 18962. Give it just another minute or so if anybody wants to type in a question.
I think I saw a question pop up about the East Florida division. Did I see one? Because they
yes,
popped
yeah,
up, but then they went away.
yes, yeah, I see that as well.
What was the question?
Sure. Is there a forum that CNOs get together at HCA division level? And how does that work? Just discussing new product opportunities, new technologies.
Yeah. So there is, you know, and we have our SMAC committees whenever we want to bring new technology in. The good news is this is already on the Health Trust purchasing agreement. So we didn't need to do that. But what we did do in our division is we used WebEx Teams to chat with each other a lot. And, you know, we'll pop up and say, I actually bought some signs that said, your voice matters, you ask, we listened. And when we buy products with the nursing capital doctors dollars, I take pictures of the staff holding the sign, you ask, we listened. And then we post it on our CNO group. And I did that with the Hercules, and I had several of my CNO East Florida division counterparts, Karen Bach being one of them, email and go, message back and say, send me the information because I would like to get those too. So we do kind of that informal, like nurse leaders do, chit-chatting type thing. And, you know, word of mouth as we sit in the meetings, what are you spending your money on? What are you spending your money on? That kind of thing.
All right. I think that concludes the Q&A session. I just want to thank Dr. Spencer for your time today. Thank you so much. And for all the participants on the call, what we typically do with webinars is we will follow up later this week with an email to just offer a post-meeting survey. Your feedback certainly helps us improve future meetings. At any time, please reach out to your Hercules representative to schedule a demo at your facility or even virtually. Again, thank you everybody for your time. Have a great day.
Thanks, everyone. Thanks, Dr. Spencer.
Thank you.